Coping with Chronic Pain, a narrative analysis of my experience with fibromyalgia. So we all know what pain is, but chronic pain specifically is pain that lasts over 3 to 6 months, which is the body's normal healing time, and it is rarely responsive to any treatment and commonly does not have a known origin. A perfect example of chronic pain is that of fibromyalgia syndrome, or FMS. Fibromyalgia is a chronic pain condition defined by reported symptoms. Because there are no visible symptoms, there's no known origin, but there is always a psychological profile that comes with the physical symptoms. Depression and anxiety are the most common comorbid symptoms. Pain, fatigue, chronic headaches, overall weakness, stiffness, tiredness, and numerous other symptoms are reported as part of FMS. The diagnosis, however, was formed in 1990 with the criterion of self-reported pain, ruling out all other potential conditions, and something called a tender point exam, in which pressure is placed on 18 sensitive points on the body, and there must be a pain response in 11 out of the 18 at least for an FMS diagnosis. So since there's no treatment, management and coping are really what people have to use for this. So there's active and passive coping, also subdivided into proactive coping, avoidant coping, and approach coping. There's problem-focused coping and emotion-focused coping. Now, problem-focused attempts to identify the stressors and then do something constructive pertaining to those situations. Emotion-focused coping, there are 2 types of that. The positive one is emotional approach coping, which is trying to identify, clarify, and further understand the stressors and the resulting emotions in order to work through that experience. There is a detrimental kind, which is rumination. That's dwelling on the stressful and negative thoughts and the threatening condition. Active coping strategies encompass proactive approach and problem-focused coping, or proactive approach emotional-focused coping. Passive coping strategies encompass passive, avoidant, and emotion-focused rumination coping. In general, passive strategies have been shown to be used more by women than by men, and active strategies have been reported as more beneficial than passive coping strategies.